My name is Robert Loomis, and I own Borgio Coffee House in Norfolk, close to ODU. It's an independent cafe, coffee shop. We've been here for about 8 years. It's been a struggle, but we're still here 8 years later.
Do you enjoy it?
Yes, with an asterisk.
Won't ask about the asterisk. All right. Tell me about your situation with healthcare, health insurance. Do you have it? Do you provide it? What's it cost, etc.?
Until about 3 years ago, we were covered through my wife's job. When my daughter was born, my wife started working part-time. And at that point, we got health insurance through this business that covers my family and currently one manager.
And affordable?
Yes. I mean, it's a big chunk of money, but we have a high deductible plan. I think we pay about $550 a month for my family and a little under $200 for my employee. I know people with full insurance plans who pay a great deal more than that. I know people who pay less, but it's affordable in the context of how much health insurance costs, I think, in this country right now.
All right. If Governor McDonald walked into your shop here and sat down, bought a cup of coffee, and said, "Rob, what should I do about healthcare, health insurance here in the state?" What would you tell him? What's your advice for the political leaders of our state?
Well, one thing that I would mention is that thus far, I think the exercise of being in a high deductible plan where our wellness visits are covered, annual physicals, my daughter's visits are covered, she's now 2. But when we get sick and go to the doctor, we pay the insurance adjusted rate to the doctor. And that's caused us to be considerate and cautious about when we go to the doctor. Do we need to go to the doctor? And also when talking to a doctor, ask them, do we need this test? Can you explain why we need it? How much will it cost? Because it seems to me, and I have a sister who's a doctor, that doctors are used to saying, well, the insurance will pay for it, as opposed to thinking of patients as consumers who need to make a choice about how they spend their dollars. And that's certainly caused my family and me to think about the impacts of how we live. If we stay healthy, if we do reasonable things to stay healthy as far as how we eat and how we exercise, we're less likely to go to the doctor. And as we're paying for that, it causes us to be good consumers of healthcare the same way we try to be good consumers of other things that we buy. In the same way, in running a business, I have to think about how much everything costs because there is an insurance company who's going to cover it if I make a bad decision.
All right, good.